Hi, my name is Eva Grazel, and I am a stage 4 survivor of tongue cancer. That's right, I never smoked, I rarely drank. Why I got tongue cancer, nobody quite knows. The surgery and everything that I had was really quite radical. I had a third of my tongue removed and reconstructed, a radical neck dissection because the cancer spread to the lymph nodes in my neck, so I only have one sternocleidomastoid muscle now, and I had a maximum dose of radiation. And radiation to the mouth is barbaric. I kept thinking it can't get worse than this, and it did. It's a burning process, so my whole mouth was on fire. And it's been 26 years. And over these years, I have worked really hard to help make sure that what happened to me doesn't happen to other people. So I have a website called 6-Step Screening, 6 Steps to a Thorough Oral Cancer Screening, and I work hard to help dental professionals educate you. I had a sore on the left side of my tongue, an unusual place for what seemed like a canker sore, which I usually would get maybe in my lip or something. Well, after 8 weeks, I go to an oral surgeon. He examines me. I complain of the pain. He says, if it bothers you so much, we could take it off. And I said, great, take it off. 2 days later, I was fine. 2 weeks later, I get a phone call from his receptionist who told me my biopsy was negative. I never knew you could get cancer in the mouth. And if I had known that it was a remote possibility, I think I would have been more proactive as the sore came back. The sore came back 2 years later. So it was a sore 2 years later, but there was a period of time where that tissue was changing, the color, the texture, but nobody educated me to look. And my dental professionals said, you don't smoke, you don't drink, nothing. The sore came back. So at that point, I was probably already stage 2. But then they look at my old biopsy report and they say, oh, this is hyperkeratosis, which they explained to me was like a callus on the tongue. They said it's nothing to worry about. So for 9 months, I was treated with gels and rinses. Then they shaved my teeth down, telling me it's caused by sharp teeth and trauma. Then one of the doctors told me maybe I talk too much. Can you imagine that? That's how dismissed I felt. So then I asked if I could see another oral surgeon in the practice in hopes that he might have a different opinion. And he basically confirmed what the other doctor said. So this other doctor said, well, why don't you go to the dentist and have a night guard made to protect your tongue from your teeth? Because it's caused by trauma. Okay. I thought it was a reasonable solution. I went to the dentist. It took 2 weeks to have the night guard impressions made. I wore this night guard 24/7 except when eating. I needed to believe that I was doing everything I could to make this thing on my tongue go away. It got to the point where I literally was waking up during the night in pain. And I wasn't eating the same foods, acidy foods, certain foods just hurt so much. And then it started to affect my speech. It was just like my tongue was just in so much pain. So I go back to the oral surgeon, the first one, and I said, look, I can't live like this anymore. We have got to do something. And he said, I guess the next step is another biopsy. I called a family friend. He was a plastic surgeon in New York City. He specialized in cleft palate. And I thought because he works here, he might know what's going on in my tongue. He said he had no idea. But had I been to a major medical center? And I said, no, never even thought of it. I mean, there was no sense of alarm this whole time. I called immediately the doctor he recommended at Mount Sinai in New York City, waiting 3 weeks to see this world-renowned surgeon who was as you can see, was the best decision of my life. I took the bus into Manhattan, not having an inkling that what was on my tongue was remotely serious. He looked at me and he said, who are you here with? And I said, I I didn't even know I needed to bring anybody. He said, well, we're going to do a minimally invasive procedure and it's protocol to have somebody with you. And I said, well, my mom lives in New Jersey. She could probably be here in 20 minutes. He said, okay, we'll call. They put me out. When I awoke, my mom was squeezing my hand. Dr. Erkin looked me right in the eyes and he said, Eva, you have a squamous cell carcinoma on the lateral border of your tongue. I said, is that the benign variety? And in an apologetic tone, he said, Eva, you are in an advanced stage of oral cancer. I remember feeling like an 18-wheel truck was driving at 150 miles an hour from my feet and then crashing in my head. And I don't remember a thing after that. I don't remember how I got to my mother's house. I don't remember how I left the hospital. All I know is I was in my mom's bed in the fetal position for 24 hours. And then she said, okay, enough. She said, sit up, get up. I'm taking you home because your surgery's in 3 weeks and you have a lot of planning. So I got home to Pennsylvania where we were living at the time. And the first thing I did was cancel these upcoming storytelling performances. Then we celebrated our daughter's 5th birthday party. And the hardest thing was calling friends and family and giving them the news. It's an extraordinary surgery. I think the doctor that I had 26 years ago was really a pioneer. Little did I know, really. But what he did was he had to take out all the cancer that was in my tongue. It was about a third of my tongue. And 3 lymph nodes in my neck. So it's kind of common to do a radical neck dissection, even if it's an early stage cancer. They want to make sure that no cancer got into these lymph nodes. So this is easy to heal from if there are no problems. No cancer spread to the lymph nodes. But in my case, they took 40 lymph nodes and 3 of them had cancer. And the lymph nodes coming down from here are very tightly attached to the sternocleidomastoid muscle, this big muscle here. And as a result, they had to remove that muscle on this side of my neck to remove all those lymph nodes. Then what they did was they felt with a third of my tongue gone, I would have problems swallowing and problems articulating if they didn't rebuild the tongue. So what they did was they took an artery. I don't know if you could see this. Maybe you can. So they took an artery right here and then this patch of skin here, which they felt was most similar to the tongue skin. Sometimes they take vaginal tissue, but in my case, they took this tissue. And they took that artery to feed blood from the carotid to the graft site. Then they took then they took 3 grafts from my leg. 2 of the grafts are called a free flap procedure, where they flapped up the tissue on 3 sides. They took the fascia to rebuild the density in my tongue. And then they took this tissue on my wrist to put on the outside of my tongue. But then they needed to replace this tissue. So they took another graft from my leg and they just took the top layer of tissue and placed it over here on my wrist. My radiation oncologist and my surgeon, it's as if they gave me birth, a second life. And I love them. Like in my heart, they hold a very special place to me. And I reach out to them every year on my cancerversary and I say, thank you. Thank you for birthing me another life. A lot of people ask what the recovery is like for oral cancer. I did not need chemo. They gave me a maximum dose of radiation to my mouth from here down to my clavicle. Maximum dose. So radiation is a burning process, and it left my mouth lined and my throat lined with blisters. Eating, I mean, it's a barbaric treatment. They put this mask on your face and it's so tight. And then they bolt it down to a table. And then they mark X's where they want to, put the most radiation. And I was very lucky. 26 years ago, I had new technology in radiation. It was targeted. I was one of the first people in this country to have targeted therapy for oral cancer. In fact, I just got very lucky. I had two little children at home, so driving into New York for radiation was not really a great option. So we had the oncologist in New York speak to an oncologist in Allentown, Pennsylvania. They conferred on exactly what I needed, and I got a maximum dose, but I got the right kind of treatment. I mean, it killed all the cancer. During radiation, I hit rock bottom. You can't eat. I couldn't eat. I couldn't sleep. I couldn't speak. This disease robs you of everything we live for. We live for having social interactions with human beings. And when you can't speak or eat, it makes it really tough. And one night, I made this decision that I had given treatments my best and I just couldn't go on. And that night, I wrote a letter to my husband about where I wanted to be buried and what I wanted written on my tombstone, because I felt it's one thing he doesn't have to worry about. And I wrote a letter to my children about my dreams and wishes for them, my pride and joy in them, my values that I hope to live on. And the following day, I felt it was only fair to tell Dr. Vigneri face to face about my decision. And I sat down in his office and he looked at me with his gentle eyes and his gray hair, that peppered hair that came to his shoulders. And he always wore this bow tie. And he said to me, Eva, radiation to the head and neck is the most difficult part of the entire body to tolerate therapy. Is there anything you need to talk about? And in my hoarse whisper, I said, I'm quitting. I can't do this anymore. He rolled his chair back. He stood up. He put his arms on his desk. He leaned towards my face, and I'll never forget the words he spoke. He said, don't tell me you're quitting. This isn't a game that you quit. It's your life. Find the strength. And I stood up. I walked down the hall and I took another treatment and another one after that. Crying made my symptoms unbearable. I learned fast to control the tears. I fought ugly thoughts with pretty ones. I replaced all those unhappy endings with happy ones. I dreamed about my future. I watched and read anything that would make me laugh. Laughing was medicine, even if it was only for a moment. It was traumatic for my children. None of my healthcare providers suggested that my children should have therapy during this very difficult time in our lives. Everybody was so concerned with me and me getting better. Nobody thought about how this disease was affecting my kids. Well, let me tell you that my daughter has had post-traumatic stress ever since. She still can't let it go. She was a very angry child at that time. Angry for good reason, but nobody dealt with her anger. So she became a very difficult, belligerent child. And even though, of course, I'm all better and I would say to her, let it go, you were 5, you acted normally for a 5-year-old. She badgers herself for being such a difficult child when I was so sick. It kills me. kills me that she's in her 20s and she's 30 now. She still deals with that. And my son, you know, he didn't go out and play with other kids. He always wanted to sit by my side. He was the older one. He was 7. And you don't realize how deep it goes. So I guess what I'm really trying to say is that cancer is an opportunity. It's really an opportunity to teach how to be a family, what it means to be a friend. These are lessons that you just don't get every day. So if you have a friend who has cancer or someone in your family has a cancer, it's just a golden opportunity to teach the next generation about community, about family, about just so many important values. I am such an advocate for making sure everybody gets an oral cancer screening at their dental checkup. So according to the American Dental Association, back in 2017, they said every dental checkup should include an oral cancer screening. But they weren't clear what it meant. And mostly they meant the intraoral exam, basically looking inside your mouth. Then in 2019, they added that it should include an exam for oropharyngeal cancer, which really means base of the tongue. So they need to be palpating your neck. So there's an intraoral and an extraoral exam, and they should both be performed at least once a year. I am one of the lucky ones who can speak articulately after going through this. And really, it's an obligation for me to pass that forward and make sure that oral cancer is diagnosed in the early stages. And the only way it can be diagnosed in the early stages is through education. It's not about the length of your life. It's about the breadth of it. And that if you could save one life in your entire existence by telling your story, it would be worth it, everything you went through. And all this, the hell that you've been through dealing with cancer, there's that little light that says, yeah, okay, I was given this hand, but I can make a difference for other people. And that makes all the difference in the world.